Hi there, my name is Cord Overton. I'm the Communications Director with the Iowa Department of Corrections. I am joined here today with three of my colleagues to bring you an update on the situation at the Iowa Medical and Classification Center as it pertains to the evolving situation with COVID-19. I am joined by the Director of the Department of Corrections, Director Beth Skinner, the Warden at the Iowa Medical and Classification Center, Warden Mike Heinrichsey, and our head medical administrator, Dr. Jerome Greenfield. I'm prepared a series of questions, many of them questions that we've been getting from constituents, and want to be able to answer in kind of a one-stop shop video interview format so that you can hear directly from the leaders of this department what's going on at the Iowa Medical and Classification Center. With that, I'll dive right into our series of questions, and I'm going to start with Warden Heinrichsey. Warden, could you give us a brief update on kind of what's occurred the last week at the Iowa Medical and Classification Center and just bring us up to speed on where we are today?
Sure. Thanks, Cord. Yeah, we had an incarcerated individual a week ago yesterday on August the 12th that had reported to the medical staff that he was experiencing symptoms that were consistent with being positive for COVID-19. So as is our protocol, we administered a test on him and isolated him. And he was positive for the virus. And then as part of our protocol, we began checking for contact tracing and seeing who others that he associates with. And it became necessary for us to administer tests on a wide variety of the population in the beginning, and we found out that there was more testing positive and felt at that point in time it was necessary to restrict movement, as a necessary step to help contain and stop the spread of the virus until we get a better understanding of where we're at this point in time. So that's kind of how we got to where we're at today.
Okay, thanks, Warden. And kind of a follow-up to that, as of today, can you kind of give us basically just the real most up-to-date numbers? I know they're always changing, but could you just kind of break down the numbers as of this recording?
As of this morning, we have 79 incarcerated individuals that are positive for the virus. Obviously, that number changes frequently by the day, by the hour, sometimes by the minute because of the amount of tests that we're doing. Everybody in our general population has been tested at least once at this point in time. But some of them will be tested again because, as the research and the experts indicate, that there's a possibility that there may be an incubation period going on and they may not be positive just quite yet. So as of this morning, it's 79. We have some more tests that are scheduled to be administered to some of our GP folks as early as tomorrow. And so 79 makes up roughly about 10% of our total population at the facility.
Okay, thanks for breaking that down for us, Warden. And again, if folks are interested in keeping up to date on the statistics, all the prison statistics as it relates to COVID-19 are updated daily. Whenever there's a change, we update that once per day on the department's website, doc.iowa.gov. I'd like to move on to the director, Director Beth Skinner. I know you're at IMCC right now using one of the spare offices there. I know you were there last week. It seems to be a frequent stop for you, as it is our intake prison. Could you just give us kind of your sense of where the prison stands currently?
Yes, I tell you right now that the leadership, Warden Heinrichsey and his staff and the staff are doing an amazing, phenomenal job. One thing we have to remember, this is not their first battle with COVID. They have been tried and tested. And we're very successful the last time in terms of containing the virus. I'm very confident we're going to do the same thing. Staff are wearing, and individuals incarcerated are wearing their PPE. I've been walking around this morning. We know that's critical to mitigate and contain the spread of COVID. And this afternoon, I'm going to spend a lot of time walking around, talking to staff, talking to positive individuals, seeing how people are doing, helping them, talk about the why it's important to wear PPE. But overall, I can tell you that they've done an amazing job here in terms of coming together as a team, strategizing, getting at the table, talking with public health, with incident command, with our medical team in terms of how best we can contain this. So really proud of the work that's happening here. I'm very confident in what they're doing.
Okay, thanks, Director. And we'll come back to you for some more questions. And I'd like to move to Dr. Greenfield, our medical health administrator. Dr. Greenfield, medically, in your opinion, how are the inmates doing there at IMCC overall? Do we have many numbers on those that are sick or really symptomatic? And are they getting the medical care that they need while they're incarcerated there?
Thank you, Court. At this time, no one has reported any significant symptoms. They're either mild or none at all, what we call asymptomatic. However, what we know from previous experience is this clinical course can change. So to that end, our nursing personnel are seeing them on a daily basis. We have medical providers that also see them. The nursing staff and medical providers meet on a regular basis. I have daily contact with our director of nursing here, ongoing checks and balances in terms of the health status of all these individuals. Because IMCC is an intake center, in other words, when people come here, they get a medical evaluation and a mental health evaluation. We have more medical providers here than we do at any other facility. We have 4 physician and 2 mid-level medical providers, so we're staffed really well. But I've also been in the process of seeing if the need would arise, what other medical resources could be available both through providers and with nursing. So at this point, the patients are doing well. I'll be meeting with the staff in less than an hour for updates, and we'll just take things on a day-to-day basis.
Okay, thanks, Dr. Greenfield. And we'll come back to you in just a little bit. I'd like to go back to Warden Heinrichsey and just ask about basically conditions for someone that is maybe in medical isolation, and then conditions for someone at the prison that's maybe in general population but on restrictive movement. Could you kind of walk us through what that looks like, what their day looks like right now under these circumstances?
Sure. Because of our need to, isolate and contain to help mitigate the spread of the virus, we're at a point where those that are incarcerated are confined to their cell for the vast majority of the day. And, we allow them to come out one room at a time, to use the shower on a daily basis, to use the phone, and use the computer to kiosk staff and or, send an email to their loved ones. And we've also set it up on the units that we can to utilize cordless phones so that we can give them more calls throughout the day. And so that's helped. We've allowed those that are in isolation to take their property with them as much as we can, because we understand that being isolated as a human being is not much fun. There's none of us that enjoy it, and we understand there's struggles that go with it. We're also, taking steps to make sure that they're staying hydrated by providing them with Gatorade and water and snacks throughout the day for those that have tested positive. And so we're keeping a close eye on them. But regardless of whether you're positive for COVID-19 or not right now, your days are pretty similar right now, because we have to take those precautions until we have a better gauge of where we're at as far as positive, because, we believe that there's probably some more that are not in isolation yet, but probably will be testing positive in the next day to week. We'll just kind of have to wait and see. So we're just trying to be very methodical and careful as we walk through this, because we want to mitigate the spread and, don't want to have anybody else test positive any more than what we already have.
And just kind of a follow-up to that, Warden, as you begin to kind of get a more clear picture of the spread of the virus and who has it, who doesn't at the facility, do you plan to try to restore movement for those guys that are healthy and not, being contaminated by those with the virus, to get them more time out of their cells, maybe time in the yard? Can you talk just a little bit about that?
Certainly. Yeah. I mean, it'll be a slow, methodical process that will involve a multidisciplinary team input from, the medical providers and the medical experts, as well as some input from, central office staff, just to try to help us, get through this. But as soon as we can start taking those steps, we will certainly start taking steps to be able to give them some more movement within their own housing unit out on the yard. And we understand that this is a challenging time for them and their families, and we're very sensitive to that. So, the sooner we can do it in a careful, methodical way, we have a plan in place on what that would look like moving forward.
Okay, thanks, Warden. To the director, I'd just like to ask, kind of, as you've been over there a pretty good amount of time, in your opinion, is the Iowa Medical and Classification Center doing enough to respond to the outbreak, one? And what more could they be doing, in your opinion?
Yeah, thanks, Cord. From being here and being, boots on the ground, I think IMCC is doing everything they can. In terms of being in communication with central office, we've been having regular meetings with incident command, working with public health. Our medical team, as Dr. Greenfield mentioned, is going to get together in the next hour. We are constantly monitoring the situation. I feel very strongly and very confident that they are staying on top of this. They're always finding, looking at the research, best practices, how best to keep people safe. I don't see I have no concerns at this point. I think the biggest thing, though, we need to do as we continue to move forward is communicate. We need to continue to communicate with the families, which we're doing here today, communicate with staff, and then communicate with those that are incarcerated, what's going on. I think that's a key piece of this that we have learned through this process of COVID, and that making sure we're getting the message out and people are aware of what's going on and what all that we're doing to keep people safe.
As a comms person, I certainly appreciate that point, Director, and concur. That has been a really big lesson learned for us throughout this process. Going over to Dr. Greenfield, Doctor, do you believe that enough is being done before the outbreak to prevent this kind of thing?
Well, again, in all my years of being a physician, I don't think I've ever come across an illness quite like this where we don't have a lot of historical information about it. We seem to get new information by the week. Rules of mitigation seem to change a lot. But I've been part of this prevention plan ever since we started worries and concerns about this. I remember meeting in public health office in February of this year. And as a department, we decided we're going to try our very best and do everything we can. We used masks at a very early time when many areas were not using them. We've now instituted the use of plastic shields as well that we use for our staff as well as our patients. But can we ever do enough? Again, with an illness that's so unknown and so serious, I don't think any of us could ever do enough. However, I think we have stayed in touch with public health, other national entities, and tried everything we can to the best of our abilities to try to do enough. And we will continue. We're not going to give this up. Our people's safety and well-being is of utmost importance. But those lines of communication with the experts will continue.
Okay, thanks, Doctor. I appreciate that. And back to the warden, one of the things we are contacted a lot, whether it's you at your facility or at our DOC COVID hotline that constituents often call, which is on our website, by the way, that one of the concerns is often from family and loved ones is, again, that quality of life thing. I've kind of asked you about it already, but I'd also like to ask, one thing we hear sometimes is they're not feeding us enough. They're not giving us enough water or whatever. Could you kind of speak to that topic of food, liquids, and just general quality of life for the guys while we're under restricted movement?
Yeah, sure, absolutely. Those that are in our COVID unit and have tested positive for COVID-19, we have taken steps to provide them with water, bottles of Gatorade on a routine schedule throughout the day, upwards of 6 times a day. And so we're doing everything that we can to make sure they're getting all the fluids that they need. And we're also taking steps to get them some snacks throughout the day and they do have the ability to order things still as if things were normal. So if they choose to order food, because they have that ability to do that off of our commissary, they can certainly do that. And we're also trying to be mindful of those that can't. So increase what we're providing them through our own lunches and breakfasts and dinner for those folks as well. For those that are not positive for the virus, same thing. We're allowing them to order food if they so choose, and we're trying to be mindful of them as well, to make sure that they have enough to eat and drink and all that stuff. So we haven't changed their ability to get the food that they need on their own, and we're also taking steps to make sure that we're providing them additional food from our end at no expense to them.
And just so we're clear, I appreciate that extra, but everybody's getting their 3 meals a day?
Yes, absolutely. Everybody's getting their 3 meals a day, and we're taking steps to give them a little bit extra during times like this. Because like I said earlier, we understand that at times like this are not very enjoyable for anybody. So we're trying to be cognizant of that, and also nutritionally just trying to do what we need to do to take care of those that are ill.
Okay, thanks, Warden. Just wanted to cover that because we do get a lot of questions on it. Going back to Director Skinner, do you think the department was prepared for this kind of thing, especially at IMCC? I mean, we just had, we just gotten through kind of an outbreak at Fort Dodge Correctional Facility. Did we not learn enough there that could have prevented this at IMCC? What are your thoughts there?
Oh, that's a good question, Cord. I can tell you, beginning in early March, we were doing tabletop exercises with IMCC, Fort Dodge, and other prisons in terms of how we would respond. We have a pandemic policy that we follow as well. And we've done a lot of work since March in preparing for this. It wasn't an if, it was a when for us. And in terms of Fort Dodge, Fort Dodge really, we learned a lot through the Fort Dodge. And the one big thing I think takeaway that I would say from Fort Dodge that we learned pretty quickly is that wearing your PPE, both for the staff and those that are incarcerated, can contain a spread. And I think that's a really important thing as now we're into this in IMCC. Again, this is their second round. We know that PPE is absolutely critical to contain this. We also know that good hygiene practices are very important, that people stay home when they're sick. Those were great lessons for us to learn, and we know that PPE works. And so I think that was something that we learned pretty quickly on, that's a very important piece of this in terms of mitigating and containing the spread.
Yeah, good point. Going back to Dr. Greenfield, are you concerned? One of the big things we get complaints about a lot is basically during a lockdown period like this, a restrictive movement, inmates might spend 23 or even slightly more than 23 hours a day in their cells as we try to contain the virus. What are your thoughts in terms of any concerns you have about that on the incarcerated population?
Well, as a physician and especially as a psychiatrist, I worry about this a lot. I think about these issues frequently. If someone gets COVID in the community, they can isolate in their homes. That's how they manage a lot of this spread of the disease, is by isolating in their homes. Here, or in any of our other 8 prisons, that's a lot more difficult simply because of the space that's allowed. So we somehow, as physicians and as healthcare personnel, have to find that balance between maintaining their mental health and also preventing the spread of the disease. As the warden pointed out, we're trying our best to provide snacks and Gatorade and food and things that would provide some comfort, as well as reading material and music and making sure they have communication with their families. And our officers here are trained in many ways, including how to approach medical problems. As I said earlier in the discussion, this is a unique facility where we deal with a lot of medical problems, so our officers have a good fund of knowledge about that. In addition, at this facility, we have 4 full-time psychiatrists and 5 full-time psychologists that are around to meet these needs should mental health issues get more severe. Additionally, we have a physician and a psychiatrist on call 24 hours a day, 7 days a week. And our nursing personnel is also very skilled. We've done a lot of training with our staff in motivational interviewing and core correctional practices of how to conduct good interviews, obtain good information. So we're trying our best to address these needs, but at the same time, stop the spread as much as we can of the illness. But it's a tough balance there.
Yeah, I completely see your point on the balance there. One last question for you, Dr. Greenfield. Basically, as you mentioned before, there's a lot of different guidances and information related to COVID-19. Is the department receiving any support from other entities out there? Who are they, and kind of what does that support look like?
Certainly. At Fort Dodge, we work directly with the Webster County Public Health, and here now in the Coralville area, Johnson County on a county level. We have ongoing discussions with the Department of Public Health, including their state experts in infectious disease. I've also been in conversations with specialists at the University of Iowa Hospital and Clinics in terms of infectious disease. And I'm also part of the American Correctional Association, and I have other medical peers that are managing their problems in other state correctional facilities and what's working and what's not working. So in essence, I'm trying to work with local, state, and on a national level. And of course, keeping updated with CDC guidelines as well.
Okay, very good. Sounds like there's quite a community of experts that we're working with out there.
Absolutely.
I guess I'd go back to kind of final thoughts maybe from the director. One thing I think a lot of people around the state are wondering about or have concerns with is the fact that IMCC is our medical intake. It's our medical prison, but it's also our intake prison for all the males coming into the correctional system. Yesterday we announced that we were suspending jail admissions. Could you talk a little bit about what went into that decision and what our hope is in terms of when we can start admitting males into the system again?
Sure. Yesterday we had lots of conversations, amongst the incident command and the team, as well as talking about what's best for protecting staff and individuals that are incarcerated. It was not an easy decision, but we realized as our numbers continue to grow that we didn't want to bring more people into IMCC and expose additional people potentially to COVID. So we made a tough decision to decide to suspend admissions for the next 2 weeks. And we'll continue to monitor what that looks like in terms of the containment. Once we feel like we have good containment in terms of what's happening here at IMCC, we will reevaluate as soon as possible to see if we can open up admissions again. And I just want to say a huge thanks to the sheriffs and jail administrators in terms of their patience and understanding it during this time. But if we really want to contain the spread of the virus here at IMCC, we need to stop admissions and we need to stop releasing people out or transporting people out from our prison until we get a hold of it.
Yep. And I think, one thing that maybe some people in the public don't understand also is after they come into IMCC, they're then sent out to the other prisons across the state of Iowa.
Right.
And so in order for us to not be sending patients to prisons that are, that have COVID-19, it's another precaution there is why we have to shut off admission so we can kind of shelter in place, if you will. Is that right?
That's correct. Mm-hmm.
Okay. One final question, Director, I guess, do you have any final thoughts that you'd like to convey to the public, to the families and friends out there as we kind of wrap this up?
Yes, I do. First, one thing I forgot to mention on a question you asked about in terms of how prepared we were for this. One thing is that we have a map. It's called a master action plan that all the prisons, and we have also provided for the CBCs, community-based corrections, to provide guidance and practices around, wearing PPE, cleaning, leave time, things like that, so we can have consistency and fidelity across each of our institutions. So I failed to mention that, and I just want to make sure that people know that we do have a master action plan that we all use and follow very diligently. My final thought is first of all, I want to thank you, Court, for setting this up, and Warden Heinersee for your leadership, and Dr. Greenfield for your expertise and your leadership with the medical side. But I want to say to families that we are doing everything we can to keep those safe. We want to keep our staff safe. We want to keep individuals incarcerated safe. We will constantly monitor those that are positive to make sure we keep them as healthy as possible. But I promise you, we are doing everything we can as a department and throwing as many resources we can into it to keep your loved ones safe. So I wanted you to know that we care about them deeply and we want them to be okay and we want them to be safe. So we will continue to fight the battle and do everything we can. So thank you for your patience during this time. I really appreciate it.
All right, with that, I thank everybody for jumping on. I know we have a lot to do, so let everybody get back to work there at IMCC, and we'll keep the public updated with those numbers again on our website, and of course our communication with the public. And then there's always that DOC COVID-19 hotline if people have questions, concerns. One thing that we tried to point out in the press release yesterday, we get questions on this. If you have a loved one that's incarcerated, that gets COVID-19, that is diagnosed, we call the emergency contacts very quickly. So if you're wondering, did my loved one get diagnosed within the last 24 hours? If they are diagnosed with COVID-19, our counseling staff are usually the ones that are doing this. We're jumping on the phones, we're calling those emergency contacts and letting them know. And then, once we get them into medical isolation and settle down, again, they're going to be able to use those phones again and communications to talk with you as soon as they've gotten kind of settled into their new medical isolation. So just wanted everybody to be on the same page with that because it's a question we get sometimes. But with that, thank you again to everybody for jumping on, and we'll keep you posted.
Thank you.
Thank you.